Bonjour tout le monde. Hello everybody. Je suis extrêmement heureux de vous accueillir aujourd'hui pour une nouvelle conférence virtuelle du CDTS. I am delighted to welcome you today for a new CLTS virtual talk, our newly weekly virtual meetup that will continue until the end of July. For those who don't know me, my name is Florian Martin Barito. I am an associate professor of law and the director of the University of Ottawa Center for Law, Technology and Society. And I am also the director of the AI and Society initiative that is co-presenting this event. For today's virtual talk, we are facilitating a conversation about contract tracing apps and different APIs that has been developed in the past weeks and months in respect to the COVID-19 pandemic, with experts from Canada and the US to offer a comparative perspective on the issue. One of these experts joining us today is our very own Teresa Scassa. Teresa is the Canada Research Chair in Information Law and Policy and a full professor at the Faculty of Law at the University of Ottawa, as well as a faculty member of the Center for Law, Technology and Society. She has commented almost daily on the issue in the Canadian context, and her expertise is thought by industry and government on the matter. She will be joined by Polly Sanderson, who is a policy counsel at Future of Privacy Forum in DC. At FPF, Polly is currently working on the privacy implication of the pandemic in the US, and in particular with contact tracing and exposure notification apps, COVID-19 privacy legislation, etc. And to facilitate the conversation, I'm delighted to welcome and to be joined by a third privacy expert, another Canadian, Lauren Reid, who is the president of the Privacy Pro, a Toronto-based boutique consulting firm that assists clients with ethical data assessment, data governance, privacy training, and compliance. Again, for people who just join us, I would kindly ask you to switch off fully your camera and unmute your mic. But without further ado, I will hand it over to Lauren to kick off the conversation. And again, if you have any question, please feel free to ask them in the conversation tab, and Lauren will take care of facilitating the conversation with our panelists. Thank you.
Thank you so much, Lauren. Thank you, Teresa and Polly, thank you in advance for this conversation. I'm really excited to start talking about it. We're going to go through kind of, an open forum discussion, and then we are going to leave time for a group discussion and questions at the end. And Florian mentioned you can put them there in the chat. You can also follow along on Twitter. The hashtag is CLTS. Virtual talk if you want to start the conversation going there on social media as well. So maybe we just kick it off with briefly, Teresa, Pollyanna, what is at stake here when we're talking about contact tracing using apps for COVID-19?
I'm not sure if you want to lead this off, so maybe I'll jump in. Can everybody hear me? Can you hear me? Yes? Okay, thanks. Well, I think there's quite a lot at stake, and contact tracing apps have taken up a lot of the oxygen in the discussion around technology and COVID-19. And so there are a range of different issues. Obviously, there's a public health issue because we wouldn't be talking about contact tracing apps if there wasn't some kind of public health dimension to the apps. They're intended, for the most part, to support public health in their contact tracing efforts to reduce the impacts of the pandemic, to stop the spread of the disease, and to help us in our return to normal. But at the same time, they raised a lot of alarm bells for people around issues such as privacy, surveillance, equity, fairness, and so on. So there are quite a few issues that are in the mix with contact tracing apps. And of course, one of the big underlying issues for contact tracing apps is whether they even work, whether they're even likely to work. And so we are spending a lot of time talking about them. It's largely an unproven, untested technology. Polly, I don't know if you have anything you wanted to add. You're muted.
Sorry about that. I think that you laid out all of the issues really well, and I think it's a great question to start the conversation with, because I think that this issue really does need to be put into the context of, it's not just about privacy, because lots of people have been talking about it in terms of privacy, and that is a major factor, but there are also so many other factors at play here. And as Teresa pointed out very correctly, there are so many issues about whether or not it's actually accurate or effective. I think that one group put it really, really well when they kind of put our choices starkly, though. Right now we're in periods of major lockdown, and that's interfering with our individual liberties and also the economy. So those are two factors. If we lift those lockdowns without finding effective methods for intervening, then that will have a major impact on public health. And so the third option is really to find like these kind of risk-based interventions in order to quarantine and isolate individuals who are at higher risks, while allowing the rest of the economy and individuals and societies to kind of reopen. But then we have to also take into consideration like equity issues. Not everyone has a smartphone. There's uneven broadband access across the US and in other places that will decrease the effectiveness or fairness of these apps. Some communities that have less trust in the government and maybe less likely to use these apps. They might be fearful of negative consequences, immigration or law enforcement. And we also have to take into consideration that these apps could redistribute resources from communities that need them most to communities that use the apps. There was one app called Street Bump that was deployed a few years ago in the US, and it was deployed by a government agency to try and divert resources to places that needed to fill in holes in the road. But it turns out the resources were actually deployed to areas where there's actually a higher income and into richer areas, because these were the people who downloaded the apps. And so that's one thing to consider.
For me, this is my first global pandemic that I'm going through. I'm assuming it probably is for a lot of folks on the call as well. And I started thinking about contact tracing in the context of apps when I found out about some of these. At the very beginning of the pandemic, there was all of these apps popping up everywhere. And we started right into a conversation about using mobile apps for contact tracing. And then I learned that it's actually contact tracing doesn't just exist in the context of apps. Contact tracing has existed for a long time manually. So can you tell us a little bit about how this automated contact tracing is different from manual contact tracing? Is it just taking something and digitizing it? What are some of the other issues that would apply now that we're talking about a device doing the tracing?
Yeah, there are, as you mentioned, manual contact tracing has been taking place for a long time now. It's a well-established public health tool when you're dealing with contagious diseases. Manual contact tracing depends on, or has depended on, sufficient human resources, and that's been an issue for public health agencies that may have had their budgets slashed or cut over the years. So one issue is, do you have sufficient human resources, especially in a pandemic, as opposed to just an isolated outbreak of measles or some other contagious disease? Do you have the human resources? And that can be one limitation on manual contact tracing. Human memory is a limitation. If you're asking people, who have tested positive, where they've been most recently and who they've had contact with, they may not remember everywhere they've been or everyone they had contact with in the last 2 weeks, so they may not even know. And that's the other limitation of manual contact tracing. You may have been on a bus with a bunch of people you don't know. You may have been in a meeting with people whose names you don't know. You may have been at a grocery store or hair salon. So those are some of the limits of manual contact tracing. And contact tracing apps are touted to have the benefits of filling in some of those gaps. So if you had a Bluetooth enabled app and it was registering your proximity to anyone else using the same app, then it wouldn't matter whether you knew them or not. It wouldn't matter whether you remembered the interaction or not. There would be some record of that interaction, and that person could be contacted if you tested positive. So those are some of the additional benefits of contact tracing apps, but I think there are some important limitations as well that we have to be really cognizant of. One is that there are problems with the technology, and I think Polly's going to talk about that shortly. So there are some problems with the technology itself. Other limits have been insufficient testing. So, you know, and this has been a problem in Ontario where we are, and I think it's been a problem elsewhere as well. If people aren't getting tested and aren't getting diagnoses of being COVID-19 positive, then that information doesn't get fed into the app, and the app is less useful. If test results are slow, that will undermine the effectiveness both of manual and app contact tracing. And the fact that so many people are symptomless is also an issue. So you've got people out there who are displaying no symptoms of the disease. And again, manual or digital contact tracing is not going to help with that issue. So I think those are some of the question marks that arise around contact tracing apps.
Polly, a couple weeks ago, we heard a lot about the Apple and Google making this API. Can you give us a little bit of a background on how that works and what are the policy and technical safeguards? Does it solve some of these limitations that Teresa has introduced in the conversation? Tell us a little bit about what that API is and what that means for this question about, you know, is automated contact tracing the right thing, and what do we need to do still to move this forward?
Sure. I think that this question really jumps off of the last question really well, because I think there's a distinction to be made not only between manual contact tracing and automated contact tracing, but also the spectrum of different types of automated contact tracing that actually exist. And at one end of the spectrum, you've kind of got the Google and Apple like API kind of approach, which is actually kind of called exposure notification. And then at the other end, and that really aims to notify individuals of exposure anonymously using rotating Bluetooth identifiers with the matching done on device rather than in a central server. And then at the other end of the spectrum, you have automated contact tracing, which really, rather than being independent of manual contact tracing efforts, but being parallel with them, like the Google Apple API, more contact tracing, automated contact tracing, is more to do with supplementing the response, manual contact tracing by public health authorities to different extents. So there's a big range of different types of contact tracing within that, where public health authorities get different amounts of data. They could get fully or anonymized and aggregated personal information, or you know, actual personal information. And so kind of zooming in on the Google Apple API, which is much more towards the anonymized end of this spectrum, I think it's really important to give a little bit of context and background to this API. Google and Apple were not a first mover in this space. Google and Apple built this API in response to requests from public health authorities, scientists, experts, and governments in this space, who were really struggling to create their own digital solutions to assist with their manual contact tracing efforts because of limitations with the technology itself. Now, Google and Apple, they provide smartphones for at least 3 billion phones in the world, so massive market share. But there's an interoperability problem between Apple and Google Bluetooth identification, which really limited the effectiveness of their contact tracing efforts using Bluetooth. And there were also loads of privacy protections baked into the operating systems of Google and Apple devices to prevent stalking and abuse by governments, which were really interfering with the ability of governments to use their operating systems for this purpose. So for instance, you can't have Bluetooth always scanning because it would create serious surveillance risks. And so the companies had like an interesting set of choices, right? So they could either do nothing and allow governments to continue doing their own thing with location data, or less effective and less accurate interventions with Bluetooth, which we did see, or they could completely open up the permissions, which could create risks of abuse, or they could come up with a compromise solution, which they did. And so I've already kind of skimmed over it quickly, but rotating identifiers stored on device uses Bluetooth, not location. And that's the technical side of it. But there's also a really important element to this, which is the terms of service, which kind of defines who can use it and under what terms. So public health authorities are the only actors that are able to actually use this API to build apps on top of it. So companies could not use this, for example. And there's only, that jurisdictions are only allowed to use, have one app per jurisdiction. It has to be voluntary, opt-in, and there are different consent stages, one at the installation of the app and another one to process data. And as I've said, it's not allowed to, these apps cannot collect location information. And there are also a bunch of retention limitations, purpose limitations, and sharing limitations built into the API terms of service. So this really restricts how public authorities can build their apps, but they also do have different freedoms. For instance, they can they have a toggle so that they can choose how long people have to be in proximity to one another, and how strong this Bluetooth signal strength has to be in order to trigger a proximity event, because they're the experts at the end of the day and they should be determining these types of things. And so obviously there are some public health authorities around the world who want more power and control, but this was a compromise that was made, and I think we'll talk more about that.
Yeah, let's do it. I'd love for you to weigh in, Teresa, on, when a country is deciding to develop an app, and they're deciding whether to use this Apple and Google API or to go their own way. Can you talk a little bit about what are those key trade-offs that these different jurisdictions have to make in terms of privacy, accuracy, and adoption rate when they're deciding how to go about this in a way that's right for them?
Yeah, well, I mean, I think one of the issues turns on what it is that they want, what it is they need, or what they want to do. And so a fully decentralized model is one that is a little bit more limiting for public health authorities who, for example, might also want to be collecting data that could be useful to helping them understand where outbreaks are taking place, how the disease is being spread within the community. And again, in the Canadian context, we've heard lots of stories about how public health authorities haven't had all of the data that they need to fully understand how the disease is multiplying and spreading within communities. So a public health agency that decides that it needs not just help with contact tracing through a contact tracing app, but also additional data, might decide that they want to have a more centralized model where they are collecting some data that could be used in a de-identified aggregate format to run analytics or do modeling. And so that's one issue for public health authorities, is what do they want to do with the data? What are their objectives? What are their needs? And then, of course, they have to think about how to do that in the most equitable and privacy protective manner possible. So that can be part of a trade-off. There are also apps that we've seen in the UK, and there's also one that's under discussion for adoption in Quebec, that are trying to supplement or replace deficiencies in actual testing, and by having a kind of an AI interface that allows people to report their symptoms and takes into account other health and demographic factors to produce a risk assessment of the individual's likelihood that they may have come in contact with someone with COVID-19, or that they may be COVID-19 positive. And so I suppose if you were in a jurisdiction where testing was the ability to test was a real problem, this kind of app might have additional benefits, but of course would have to collect additional data, and then you'd have to be thinking about what kind of safeguards you'd want to have in place. So I think a lot of the discussion needs to start from the perspective of what it is the agency is trying to do, what they need, what their wants are, and then is there technology that can deliver that. And I'm just going to throw in, to be a little bit cynical, because I find it hard not to be, is the additional issue that that there's, there in countries like the US and Canada and European countries, there's a lot of push to innovate and develop in the tech sector. And so for many tech companies, this is a real opportunity to show their stuff, to try something. We're talking about pretty widespread deployment of these apps and technologies, a chance to experiment with something new and try it out. And there may be another hidden purpose for government in terms of wanting to support or stimulate technological development in their economy. So that's I'm going to put that as a little cynical aside and something to think about. And I think all of these factors, or all of these things, are really important to think about when we're considering, should we be adopting a contact tracing app? Why are we adopting it? And what are the parameters we should be putting on it? And when we're demanding full transparency from government around these issues. I think you're muted, Lauren.
Yes, this is like the battle cry of 2020. I think you're on mute. So of course I am. I was just saying that maybe, Polly, you could weigh in a little bit on the trade-offs as well. And I'd love to hear a little bit deeper on the explanation of some of these technical issues around Bluetooth versus GPS location, for example, and what we're seeing in some of these countries of how they are approaching these decisions around trade-offs.
Sure. So whenever I think about these issues, I always start from the position of like, what are the key trade-offs in the design of these apps? And I've come up with 4 key trade-offs. One of them is centralized versus decentralized, GPS location versus Bluetooth, or other Wi-Fi or other ambient signals. And then voluntary or mandatory, and then confirmed diagnosis versus self-reporting. And with all of these 4 kind of central key trade-offs, there are loads of different things to think about. You've got a bunch of different privacy implications, effectiveness implications, and interferences with civil rights and civil liberties. And so starting with centralized versus decentralized, I think that the biggest risk involved with the centralized approach is obviously mission creep. It's the thing that we hear about most. And I know Teresa's already kind of alluded to this briefly. In China, they have already, we're already hearing signs that their app is going to potentially be made is going to remain for general public health purposes. In the UK, there were documents released which showed that there were other potential purposes in the future that hadn't been communicated to the population, such as immunity passports. In Florida, we're hearing potentially how useful these apps could be for storm management. And so, we're already starting to see slight function creep, or potentially. And once the infrastructure is in place, that's really tempting for governments. It's really tempting. And that's the biggest concern. And then secondly, data breach is a concern with the centralized model. Now, with the decentralized model, you've got the problem that there's going to be less data available for public health authorities to use for risk modeling and analysis to potentially combat COVID-19. But we've seen in Asian countries that actually, other sources of data have been potentially more useful to combat COVID-19, such as data made available from telecoms providers, search engines, social media posts about symptoms, and, medical records, financial data, all being aggregated, which has been potentially more effective, but then there's obviously privacy implications associated with all of those. And there are other apps for some of these things. Like in the UK, there's a research app, which individuals can use by choice to input their symptoms for the purpose of research. There are symptom tracker apps, and there are quarantine compliance apps. There are all different types of apps. It's not just contact tracing apps. So those are some of the biggest issues with centralized versus decentralized from my perspective. Now, with the voluntary versus mandatory conversation, there are certain countries that have made their apps mandatory, such as Qatar and Turkey, and this helps with adoption. But there are also ways to always get around mandatory uses of these apps. If you really want to, you can just turn off your Bluetooth, you can leave your phone at home. And it can really interfere with trust. And I don't think that it aligns with the values in a liberal democracy, especially when effectiveness is not proven. It's really difficult to mandate an app when there's a lack of evidence of effectiveness. When it comes to the voluntary options, there's not just one option. There are various options. You could have an opt-in app, and then within that you can have opt-in at various stages, such as installation of the app or sharing of positive diagnosis, or this could be done automatically. Or you could have an opt-out app, which is a kind of in-between option. But there are also incentives that you can kind of create for people to download the app without making it voluntary, such as economic incentives or trust-based incentives. And this could include in building privacy protections, transparency, making sure that the app is accurate, involvement of community voices, accountability and oversight, and legislation and penalties. And then, you've got other trade-offs are, there are just so many different things to say about them, but I don't want to take up too much time. But I will say one quick thing about Bluetooth versus GPS. There are accuracy issues associated with both. GPS location is less effective in urban environments and also within large buildings. And Bluetooth, it won't be able to, there might be accuracy issues if you're wearing clothes or if your phone is orientated the wrong way, or maybe there's a wall between you and another person. And it's never going to detect, neither of them are going to detect whether or not you've got PPE gear on. So there are always going to be accuracy issues which create false positives and false negatives. But location data is more privacy invasive. It's really difficult to de-identify because people have such individualized movements. Most people spend most of their time just going between work and home, and it's really difficult to de-identify those locations.
Thank you. We're talking a lot about decisions and things to think about for governments and how they're perceiving these different options. Can you both tell me a little bit about what are the public attitudes around contact tracing apps? And we touched a bit on the notion of government collection of location data on its own, but then in the context of COVID-19 and in the context of this app, how are people generally feeling about this?
I think that's an interesting question, and I think it's one that's hard to measure for a number of different reasons. There have been surveys done recently in Canada that have found relatively strong support for contact tracing apps, but as you'll see from the discussion we've been having so far, there's a whole spectrum of different contact tracing apps, and they do different things in different ways. And so if you just simply ask someone, are you in favor of a contact tracing app or not, and they say yes, it's not clear what exactly they're saying yes to, and it may not be clear to them. And there's some indication that some people believe that contact tracing apps function a bit like radar detectors, where you'll be out in public and it'll, your phone will start beeping if you're getting too close to somebody who has COVID-19, and you can take evasive action. But that's not how they function at all. It may be that the testing isn't done and the results aren't in until 10 days after you've had that contact and you're notified that there's been a contact. So I think it's really hard to assess how much information people actually have when they're being asked, do they favor a contact tracing app or not? And whether they favor one or not, then there are different issues about whether they are going to find it usable when they have it on their phone, or they're going to want to use it on their phone, or whether they have proper access to a phone, whether it is sufficiently accessible in the language that they're most comfortable with, or at a level that they're comfortable with. So there may be all kinds of uptake and usability issues there. So I think that's one thing that's hard to assess. And it also may be that some people are okay with contact tracing if it's a very privacy protective model, and others, and the same person would not be okay with a more invasive model. But the other thing I think that we need to think about is the extent to which people are willing to make sacrifices in order to get the pandemic under control and to return to some sort of normal. And so there may be people who are quite willing to accept some limitations on their privacy or some incursions on their privacy in order to have a good result. We've all accepted staying home, and we've all accepted isolating ourselves from others. Everybody has made sacrifices during the pandemic. People have lost their jobs and so on. So I think there may be a general willingness in the population to do what it takes in order to get back to normal. And there, I think, is a danger that contact tracing apps get oversold to a population. And this is why I think it's really important for governments to be transparent, not just about the privacy dimensions of their app, and transparency in that respect is important, but transparent about what their objectives are, what their realistic expectations are, what the known risks and drawbacks might be, so that people can make informed choices. I think we have to remember throughout all of this that these are unproven, largely untested technologies that are being deployed on on the whole population, and it's an extremely vulnerable population. It's vulnerable socially, economically, in terms of physical and mental health. And so I think in that context, it demands the highest level of clarity, transparency, openness with respect to what it is the government is trying to do and how they're planning to go about doing it, and what limitations and barriers are there. And I think that Pollyanna mentioned trust earlier, and I think trust is a fundamental piece here.
Well, I think you're talking. I think you brought up some really great points about the economic impact of this, and the fact that we're all really eager to go back to work. And we think about contact tracing, and when we talk about the Google and Apple API, we're talking about public health authorities that have to be able to use it. And we're talking about, government and officials, and how do people feel about trust in that context. But when it's time to talk about going back to work, and we're shifting gears now to think about enterprise deployment of these apps, and how people feel when it's their employers saying, we need to collect data about you to decide if you're going to be able to go back into the workplace, and their obligations to the other employee's safety, to the employee whose data is being collected, et cetera. Maybe, Polly, can you talk a little bit about enterprise contact tracing tools in terms of the technical perspective, and also why are they being contemplated?
Yeah, sure. So first thing to say, I suppose, is that contact tracing from an enterprise perspective is being thought about as part of a wider get back to work strategy. I think you've already outlined it well. The employers are concerned about this health and safety of their employees, and they're also concerned that employees are worried about going back to work, and they want to feel safe in the office. Unions and workers councils also are pushing for safer environments. And so employers have this responsibility to develop comprehensive return to work strategies, and contact tracing within the enterprise environment could be part of that solution. And it's being considered actively by various employers. But there are other types of solutions being proposed. So that's just the first thing to say. Now, before contact tracing was being contemplated within large employers' offices, in order to detect whether someone had COVID-19, there were more privacy invasive methods being used, such as sending around an email with 2,000 people on it, saying you might have been exposed to something, and then shutting down entire offices, which may cause undue anxiety for the employees and for their families. I think it's also really important to distinguish these apps with the consumer apps. The function that enterprise contact tracing apps are hoped to be useful would be more to kind of support HR with their manual contact tracing efforts, which would be kind of similar to automated contact tracing to support manual contact tracing of public health authorities rather than the kind of Google, Apple anonymous approach. And so it would be potentially less voluntary. Like some people might, it depends on the employer, but some employers might require their employees to download apps to return to the office. And that might be okay within environments where you can choose whether to work from home, but some people don't have that privilege. And so then you get into real questions of consent. And, it would kind of create information for HR to use in general. And so I'm going to use a kind of case study because there are a bunch of different people proposing contact tracing solutions in the enterprise context, but PwC have been really vocal about their solution. They already had a kind of identification tool for employees within their workplace before the pandemic. So they were a first mover in this space. And that was really for employee safety within a large office. And obviously, employers can't use the Google Apple API because it's only for public health authorities. So rather than just relying on Bluetooth, they would also rely on clusters of ambient signals and then compare clusters to one another so that it kind of creates a more accurate and more reflective picture of like where people are located within the office. And then they would defer a lot of responsibility to individual employers. So our department would be able to kind of make a query about an individual. And this could be based on a confirmed diagnosis or self-reporting. And then they'd be able to get a list of names of people who were in proximity to that individual. And that's all that would be shared with them. But then the employer that receives that information would then need to determine where to store that spreadsheet, what security safeguards to put in place, whether to update their privacy policy, things like that. And it's obviously company policy, whether or not it should be mandatory or opt-in. And the client would also be able to kind of use a toggle, like I said, with regards to the Apple-Google approach, where they can kind of define what a proximity event is, what is high risk. And so there are a few issues like with this, consent being the biggest one potentially. Equality, what about people who don't have smartphones? What if you leave your phone at home? What if you leave it at your desk? What if your battery dies? But this is also in the US, especially where, the response has been kind of disjointed from the government. Coordination within large employer situations could actually increase adoption of this technology and, make it more normalized within society. So it'll be interesting to see how it unfolds.
Thanks. So we talked about just general public, kind of the government and public health agencies, and we talked about the employment context. Teresa, are there other contexts where you think that we would be likely to see some form of contact tracing or other types of monitoring and surveillance for COVID-19?
Yeah, and this is an actual app. I just noticed yesterday that the Ontario government, in announcing its stage 2 of getting back to normal, which starts on Friday, indicated that for certain types of businesses that are reopening, hair salons and so on are one of those types, but there are others as well. They're recommending that those businesses record contact information of each of their clients and retain that information for contact tracing purposes. And I thought that was interesting to see that in the back to return to normal plan. And it's not a technological collection of the data, but it is asking businesses to essentially record contact information and retain that information for contact tracing purposes. I thought that was interesting. I think in other countries, we're also seeing the use of things like scanners and QR codes to get into things like shopping malls, public space, public buildings, or areas where there are a lot of people, and it's hard to sort of to know where everybody is at any particular point in time, so that people are having to scan a code using an app on their phone to get into those spaces, presumably to record that they were in those spaces in case there's a later notification that has to be sent out. And so we may start to see these kind of technological or otherwise types of recording of data for contact tracing purposes as people start to move out into, you know, restaurants and retail spaces and hair salons and, you know, all of these other types of things, even beyond the workplace context.
Mm-hmm. I personally have gotten 2 notifications because I use my my Shoppers Optimum card. And Shoppers had said, you have been here at the same time as an employee who has tested positive. And to your point, they do. I don't know what I'm supposed to do with that information because at the time I couldn't get tested. So I think this has been an amazing discussion about all of the facets of this from, you know, and it's not just privacy, it's around equity, it's around effectiveness, it's around accuracy, and all of these policy implications of things that are unknown to us right now, or maybe they're known and it's a good thing and maybe it's not such a good thing. Law, however, doesn't regulate things like equity and access and effectiveness. And so I think a lot of this conversation is happening in the privacy space because that's where we talk about law and regulation. And so maybe before we open up, if people could think about their questions and put them into the chat, maybe before we go into the Q&A, I'll ask you both to talk about privacy law, starting with Polly, where in the US, there is no comprehensive federal law. So you're relying on technical safeguards and public commitments from companies saying, you can trust us. What are those enough privacy protections for people? Are there other privacy protections in the absence of a law? And kind of where, if you could look into a crystal ball to see what's kind of coming in the future for the US, what do you think that you would see?
Yeah, I mean, I think the first thing to say is, no, this isn't enough. And, you know, the FTC commissioner has recently been speaking a lot about how she wishes the comprehensive federal privacy law was already enacted before the pandemic. And I completely share those views. I think that this has really, hopefully, reinvigorated the privacy debate around federal privacy legislation. But in the meantime, you know, public commitments and the FTC Act and App Store policies and sector-specific laws are just not cutting it. They're not enough. And I think that that's really reflected at the federal and actually also state level with different proposals that are being introduced. I think the most significant and relevant proposal for our purposes is a bipartisan bill, which is rare in privacy in the US, that has been introduced by Cantwell and Cassidy. And this is kind of the first really visible attempt at national leadership around digital contact tracing specifically. You know, it would require voluntary participation, collaboration with public health authorities. It has purpose limitations, retention limitations, data security restrictions, anti-discrimination provisions in places of public accommodation. I think that the in collaboration with public health authorities is a really interesting provision because it could be interpreted in different ways. You know, some people might interpret this to prohibit or preclude employer-based apps, but I think that my interpretation of it is that anyone who is not a public health authority would need to seek some level of guidance and have some kind of input from public health authorities to increase trust around those apps. And then outside of the Cantwell-Cassidy bill, there have also been some general COVID data-related bills introduced. One by a Democrat, Senator Blumenthal, and another by a Republican, Senator Wicker. And they have a lot of similarities, but also some differences, which kind of fall along party lines, such as whether to have a private right of action, whether preemption should be, whether it should be preemptive, you know, whether there should be anti-discrimination or research provisions, and also, you know, what kind of data is covered, should publicly available information be excluded? And, you know, that has big implications for, you know, potentially social media scraping to power facial recognition tools. And then outside of this, Senator Warren has also introduced a bill which would create a national strategy for contact tracing. And that would be mainly to do with manual contact tracing, but also has a couple of provisions related to automated contact tracing. I think it's interesting that the partisan bills introduced kind of fall along the same party lines as the recent significant bills introduced for comprehensive privacy legislation. And I really hope that it reinvigorates the discussion.
Thank you. Teresa, talk to us about the Canadian privacy law context. I think it's very different in terms of the legal context of doing this type of contact tracing and using automated apps.
Yeah, and so, I mean, there are some things in the Canadian context that are helpful. There's a sort of a more universal presence of privacy legislation, although the legislation itself is patchwork and out of date almost universally. So that's an issue, and I'll just leave that aside for a second. The commissioners in Canada, the federal and provincial privacy commissioners, have created common positions, guidance statements, joint statements and guidance documents around COVID-19 and privacy-related issues. And I think that's been tremendously helpful in setting out a common view of how, for example, they have a joint statement on contact tracing apps and on what principles contact tracing apps should follow. And so I think that those kinds of joint statements and guidance are incredibly helpful across the country at a national and provincial level to have that kind of common front. They are doing that, though, in a context where they're all working with different statutes that are deficient or out of date in different ways. And so it's patchwork legislation, both in terms of its spread across public and private sectors and health sectors, and then also in terms of the state of that legislation and the powers that are available under those legislation, under those statutes. And just to give you an example, at the guidance, the commissioner's guidance is framed around the principles of necessity and proportionality, which I think are really important principles in the privacy context. But necessity and proportionality are not explicit in the Federal Privacy Act, for example. And necessity is not a basis for collection of data under the Federal Privacy Act. And I think that that's simply a reflection of how the statute is out of date and remains out of date. So there are those kinds of issues. PIPEDA, we've, on many different occasions talked about how deficient and out of date PIPEDA is, and some of the ways in which it's out of date are, it's based on a very low tech model of data collection, and it isn't well adapted to a context in which you have big data analytics and artificial intelligence, and although the commissioner has done his best to adapt it to the app context, to the mobile app context, there are still ways in which it's not ideally suited to that context. And so that legislation in the private sector context is fairly deficient as well, and has weak enforcement. And I think that's been a chronic problem with PIPEDA. In the employment context, privacy laws, public sector and private sector data protection laws apply differently across the country in terms of the employment context. And so there's no single standard for employee privacy that's protected by our data protection laws, and it actually can vary quite significantly. And I think that's an issue as well. So I think that some of these deficiencies, it may be that the COVID-19 pandemic is highlighting some of the deficiencies that we have kind of nationally and collectively with respect to responding to these types of issues, technologies, data collection in the public good, and thinking about how to the extent that trust has become such a big issue in governments being able to collect the data that they need in the pandemic, and how much resistance and push that back there has been both domestically and internationally with respect to contact tracing apps. I mean, I think this reveals that privacy is important, trust is a big issue, and the legislative infrastructure needs to be there. And the one other thing I'll note with respect to I think I mentioned with respect to PIPEDA that not well adapted to the AI context. And I think that that's another deficiency, not just in terms of the privacy aspects, but also, I think, as Pollyanna has mentioned, in terms of the human rights dimensions. And so because we've got privacy legislation and it's labeled as privacy legislation, the word privacy gets used in the title, that privacy becomes the paradigm for thinking about all of these things. But there are much bigger issues that are involved. There are human rights issues, there are civil liberties issues, there are ethical issues, and there isn't really a good place for all of those. And I think the GDPR has found a way to bring more of those issues under the umbrella of their data protection law. And I think we also have to be thinking about how we do that. They've got to be somewhere in our legislative infrastructure. And, and some of those issues can be brought into privacy legislation, but we have to think, more broadly in terms of not just privacy as a privacy right, but data protection and the protection of data with a view to protecting the collection of human rights that are now being affected by the collection and use and disclosure of personal data.
Thank you. I want to just give you both a chance to have sort of final word. Is there anything to add? Anything you wanted to build on, or should I go to the questions in the chat?
I'm happy to have you go to the questions in chat so our listeners can get a chance to weigh in.
Sure. Okay, so let's start with this one. Are there, because it kind of builds on what you were just talking about in terms of the regulatory aspect. Are there any international guidelines or best practices to guide the implementation of contact tracing apps in various jurisdictions that consider these ethics and trade-offs?
Do you want to start off there, Teresa, or shall I?
Why don't you go ahead?
Okay. Okay, I think the first thing that I would say about this is that in Europe, they were quite quick movers to produce a lot of guidance on and recommendations on the deployment and implementation of these apps. And there was some conflicting guidance from the European Council, the European Commission, and the European Parliament. The European Data Protection Board actually kind of clarified their interpretation of all of this guidance. So the European Parliament, they were quite adamant that they favored a decentralized approach, whereas some other branches of the European Union were more ambivalent about which kind of approach they favored. But then just kind of talking about different principles, purpose limitation, necessity, proportionality, and then taking into consideration effectiveness and monitoring of performance. In the US, there have been a few different principles that have arisen from the CDC has a few kind of limited principles. The MIT has released some privacy principles. Hopkins has released some guiding principles. There are model data protection agreements out there now that states can kind of look at and implement more easily than having to write their own. And I know that Canada has released some privacy principles as well. So I think that's a good time to kind of hand over to Teresa.
Yeah, that's right. And those were the guidelines that the commissioners produced on contact tracing apps and have on their websites. Yeah, and I mean, 3 months ago, nobody was talking about contact tracing apps. And so there's been actually a tremendous amount of thinking about them, writing about them. There's been technological development about them. There are many different white papers, discussion papers, analyses. So there's a tremendous amount of material out there that talks about, what the issues are, how to address the issues, both technologically and in terms of legislation. And then some states have started to weigh in the EU in particular, with their own guidance. And we're also starting to see some contact tracing apps being released with privacy impact assessments, which can be helpful also in thinking about them. So it's not that I think in 3 months that would be a remarkably short span of time in which to have international consensus on a set of guidelines for contact tracing apps. But given how short a space of time it is, there is a tremendous amount of, I think, very thoughtful material that's out there already about these things, and from which maybe at some point some consensus may emerge. And it may be that we're going to have to, at the end of the pandemic, go away and think about what lessons we've learned, and try to apply them going forward.
So I'm going to attempt to combine and consolidate some of the questions in the chat. It's kind of so forgive me to the people who asked them if I don't perfectly reflect it, but there's some great discussion going on about what are the roles and responsibilities. It was talking about the Google and Apple's API, and then the apps that are built on top of it. And the question is, who's going to vet that software code? Is it going to be Apple and Google? Is it going to be open source? It mentions that this is something that the EU was trying to do. And I think it's relevant to the question that we just asked about the international standards on privacy. But from a technical perspective, does either of you want to kind of take that on the, the operationalizing these apps to say, okay, say it's a perfect world and all the countries and leaders and people in public were consulted and we all had the same access and equity and everything, we all decided unanimously that we'd like to have contact tracing apps and we're comfortable with the data collection. Now it's time to build them. And how do we make sure that they built them and that they're doing the thing that we all agreed to, and that they're not going to change their mind later, as you pointed out earlier, Polly, about the scope creep. So from, that's a utopia that doesn't exist on having this unanimous agreement. But what if we did? Would it be possible to translate those agreements and that kind of social contract into an actual app?
So I think that there are quite a few different questions kind of built into that, and I'm going to try and kind of unpack it. From my perspective, I think that you bring up a lot of really, really great points, and there are a few different questions that arise in this context. First, it's not only about like what standards and rules should be put in place, but also who is making those rules. And as like the legislative process is ongoing in the US, business and platform standards are arising and they're falling into place, and technical and policy decisions are being made within companies and by like governments, local governments on the ground. And there with the PE, PP, PT, and the DP3T initiatives in Europe, there was like major input from like hundreds of international researchers, ethicists, epidemiologists, scientists, psychologists, security experts, technologists, philosophers, like loads of people getting together and contributing to these kind of approaches. And I think on the question of whether the source code should be available publicly, yes, it absolutely should. I think that a lot of these apps have made their source codes public for public scrutiny, which adds another layer of oversight and public accountability. And along with the data protection risk assessments that Teresa was also talking about. So yeah.
Thank you. So I'm just looking at the time. There's one more really amazing question in the chat, but I think it's going to take more than 2 minutes to answer it. But I think, let's just try to do, I want to be respectful because I know it's the lunch hour. People have busy days, but I think this is a really wonderful question. And so maybe we could just wrap up on a really kind of as consolidated as you can response to the question about what risks, if any, do the processing of aggregated location data create at the group level? And are there any discrimination risks related to modeling mobility patterns or disease transmission? So huge question, but I think that this question around aggregation and group level risks is really key to what you've both been talking about throughout this discussion.
Teresa, you want to have a crack at that?
Yeah, so the short answer is, yep, there are risks. And I think, and there are all kinds of complicated risks once you start doing that. I mean, I don't know got to choose, time is short, I've got to choose an angle to come in at that. I mean, one thing I think is there's always this danger. It's not just the data, but it's also the interpretation of the data and how the data is read and understood, and who's reading and understanding the data. So there are risks, for example, in how data is going to be interpreted and understood if you're showing particular hotspots, for example, in particular areas. So there's a couple of things that could happen with that. One is it could lead to people shunning those areas, avoiding those areas, and that could have consequences or implications for those individuals or communities. And it may be that the hotspot is actually a very contained area, like a long-term care residence where we've had some real hotspot or outbreaks, and it doesn't affect the broader community. And yet on a map, a heat map, it looks like, you know, that community is one that you'd want to avoid as a whole. So there are risks with, you know, with how data is interpreted or understood or how it's presented. I know at the start of the pandemic, Google, for example, produced a whole bunch of analytics based on its location data, about showing, and they were presented as you know, how we would see different ways in which people have been responding to the messages to stay home, for example. And so it was, you know, it looked like, well, in some areas people were complying very much with the edicts to stay home because it had, you know, the movement of people had dropped a certain amount, but it hadn't dropped below a certain amount. And so some interpretations were, well, that people weren't necessarily complying with the orders to stay home, but that ignores the fact that there's a whole bunch of people who still had to go to work. Healthcare professionals, people in grocery stores, people in, you know, who worked in essential functions, they had to get out of the house every day and go to work. And so, you know, you could read it as non-compliance, or you could read it as pretty good compliance, given that a big chunk of people, and perhaps in some of the less compliant areas, those might be where the people lived who had to actually get out of bed and go into work when everybody else was staying home. So I think it's not just the collection and the modeling of the data, but it's the interpretation and the understanding and the analysis of the data. And I think we have to be really careful if we're going to do, you know, if we're going to collect the data for these purposes and do these kinds of analytics, that we have really thoughtful, careful analyses that don't have us leaping and making certain assumptions and drawing certain conclusions that are simply aren't accurate or factual, or that miss important things that are happening that need to be better addressed.
I think this is, I love this discussion, and I think we should continue it on Twitter. There is a hashtag for this event. It's like, I love it, on this, how we make the decisions once we get past this idea of collection of the data, but how are we holding people accountable and making decisions that are fair and equitable. So we have to close. I'll invite Florian back to close, and I would love to hear this conversation continue on hashtag CLTS virtual talk.
Yes, thank you. Thank you so much, Lauren, and thank you for facilitating that conversation, and for Polly and Teresa for like all those thoughts and comments. It was like super interesting, and people in the chat are saying the exact same thing. So it's the beginning of, well, it's our third virtual talk, but there is other coming in the following weeks with colleagues from the Middle East, from Brazil. I will like also bring a more like maybe global south perspective on the issue. But in the meantime, I will invite you all to join us again next Wednesday, same time, 12 p.m. for a talk by Payal Arora titled "Do the Next Billion Users Need More Innovation?" A conversation about rethinking AI for the common good, where she will present some of the arguments she made in her latest book that received the Prose Award for business. So I look forward to seeing you again next week. And thank you again for our panelists on today's event. Thank you.